My guest today is Dr. Mike Martinez, a local anesthesiologist. Mike, thanks for talking with us today. Tell us a little bit about your background.
I've been, a medical professional probably since 2015 when I graduated fellowship. I went to medical school here in Fort Worth, and before that went to UT Austin. And then my career's kind of changed over time. I started my practice out in Weatherford, and then I left that practice and then came here to Fort Worth to create my own practice. And then I've continued a couple other things, doing obstetric anesthesia, doing general anesthesia, and then of course my practice here, which is chronic pain and sports medic. So the practice has kind of evolved over time, or my practice has.
Okay.
And now I'm also assisting as assistant associate professor at the Baylor All Saints TCU Burnett School of Medicine. And so I'm the chronic pain director there as well.
Awesome.
So I'll have the opportunity to work with some of the local residents that, will come along because we're fielding our first class this year. And then as they kind of go on to graduate, hopefully we get to retain some of those medical professionals for the local population.
Okay, cool. We appreciate what you're doing for the community with that. You're very gracious and said I can just come ask you questions I have. I have a lot of interesting questions, and you said your views are your own. They don't speak for any institution, so here we go. What are the major trends we're seeing with hospital purchases?
Most of the hospitals are doing some degree of purchases, and it's mostly the corporations. And so corporations like your insurance companies will purchase hospitals. And then of course you have large corporations like THR, HCA, and Baylor that are also purchasing other hospitals and expanding. But they're doing it in different ways. So Baylor and THR are putting a big emphasis on primary care doctors, and so kind of like the feeder system for their hospitals.
Okay.
And HCA has put more of an emphasis on location and also specialists. And so they haven't really been putting a big emphasis on the primary care doctors as much. They're starting to change that though, and they're starting to go that route because they're probably seeing some of the effects that Baylor and THR are having with market share.
The next topic I wanted to move on to is anesthesia, your specialty. And for folks who've never gone under, what are some of their top concerns? And if you can kind of address someone who's maybe going to go under anesthesia for the first time, what should they be asking, and what should they know about the procedure from your point of view?
I think it really depends on obviously the type of surgery you're going to have. Certain things you're going to want to do certain styles of anesthesia versus others. And probably the first thing that's going to be a limiting factor is what is the surgical procedure you're getting done. If you're getting a laparoscopic procedure, we're probably going to have to put a breathing tube in place because we're going to have to assist ventilate you during the procedure. Because whenever they put air inside your abdomen, it's very hard for you to breathe.
Okay.
And so that's why we have to assist with the breathing tube. In order to do that, make you comfortable, you got to do general anesthesia, so you got to be asleep. So it just really depends on what's your surgical procedure. There are a variety of different ways you can do stuff. So you can always do regional anesthesia. So that's going to be like your epidurals, your spinals, your combined spinal epidural, or maybe doing a peripheral nerve block. Or you can even do like another regional technique, which is called a beer block, which is basically we put a tourniquet over your arm, and then we exsanguinate. So basically you wrap it with the arm to push all the blood out of the extremity, and then you put the tourniquet up, and then you put a bunch of local anesthetic that'll take the place in the venous system of that upper extremity, and it numbs it up for the surgery.
How much work do you do before that process, and how safe is it, I guess?
Well, general anesthesia or any type of anesthesia in general is pretty safe. The complications have been reduced dramatically over time. And it has to do with increases in safety checks that are put in place both within the machine. Also, equipment has evolved over time to be better. And so I think a lot of the times it's not really the anesthesia that creates the issue, it's what's the surgical procedure they're doing for you with what's your medical condition going into it. Because we can compensate a lot, but it comes down to we can compensate up until a point. And so if you're involved in a trauma and maybe there's been a large amount of blood loss, If they don't find that where that blood loss is coming from, it doesn't really matter what we're doing from the anesthesia side of it. So it has to work in conjunction with your surgeon. The tough part is when you go see a physician.
Yeah.
It's almost like, going on a first date. I think of it as going on a first date. You go, you meet them, you see if you kind of like work together, if you jive, or if you feel like this could be a good relationship. But I also think you shouldn't be afraid to go get a second opinion.
Okay.
And if you're afraid to go get a second opinion, then I mean maybe that's telling of the relationship you have with the first physician. Like maybe you feel like you can't question his judgment. Me personally, if a patient ever told me like, hey, I'm going to go get a second opinion, I'm like, great, tell me what he says. And that's kind of like my approach. I think people should be free to choose what they want to. I'm not going to sell you on anything. These are your options. This is why I think it could be better for you, and this is what I recommend. But if you feel like it's not the direction you want to go, hey, go talk to somebody else, see if you can find a better direction. But that's kind of like the way I try to present it.
And people are intimidated by medicine, so it's an interesting topic, but you're saying don't be afraid to, you don't have to be a doctor to do some preliminary, research on this.
Yeah. And I think the tough part too is like, where do you do the research? How do I know I can trust this information? And so
your doctor can provide that information.
I think you have to look at like where the source is coming from. Like if you have local shade tree doctor that got his like medical degree from Tijuana School of Medicine, and he's the one that's putting out information. Versus you have another doctor from Stanford or NYU who's putting out information. You kind of have to look at where's the source of the information is coming from. So you kind of evaluate like what are this person's credentials. And you shouldn't be afraid to just kind of say like, what, there seems to be more information coming from these more reputable sources saying something that's contradictory to what this guy is saying. And you shouldn't just go with what that guy's saying because that's what you want to hear.
Okay, that's the other part.
Yeah.
But go ahead and plug your business while we're here. We're on the near south side. What's your address and your website? Folks want to reach out to you.
My business is called Way Out West Spine and Mobility. Part of that was done so that we could put more of a focus on patients kind of working on the physical therapy aspect of recovery. And then I also wanted to focus kind of the Western aspect of Fort Worth. And of course, one of the slogans for Fort Worth is where the West begins. Correct. And I thought Way Out West would be kind of a unique kind of like tangent of it. And then as far as website, it's wowspine.com, so WOWSPINE.com. And then I'm also on Instagram, TikTok, wowspine. I put some videos out there kind of like about like typical procedures we do. And so that's kind of this business. And then of course I have a couple other jobs, as I said, chronic pain director for the anesthesia residents here at Fort Worth. I also do general and obstetric anesthesia at some of the local hospitals. So kind of do a little bit of everything.
It's a lot, and again, we appreciate you being open and communicating these things. We don't always hear from doctors, right? For whatever reason, we don't always hear them talk openly about X, Y, and Z, and it's really great that you kind of just put it all out there. People can learn something practical and hopefully follow up and check you out. So.
Well, I'm hopeful. I think that I think one of my attendings in residency kind of described me as gregarious. So just being able to have a conversation. And they actually used to put me on neurosurgery cases where the patient had to stay awake during the brain surgery. And so it would be because certain things where maybe the mass was close to the location for speech and function. And so we had to keep them talking and communicating. And so that would be like one of the cases they'd always put me on because I could talk to a wall all day long. So I think that's kind of like the way I try to engage patients when they come see me is let's talk.
Awesome.
So hopefully some of your readers or viewers get some information out of this. And of course, like you said, this is all my opinion. It's not like I speak for any other organization other than Way Out West because that's my business. But if anyone has any questions, always feel free to come in and talk, and we can talk about options.
Okay, well, thanks for your time, Dr. Martinez. Appreciate it.
Yeah, appreciate you.
It was fun.